Principal at Neuro Needs, and today we're delighted to have Dr. Zendi Moldenhauer talk about understanding childhood anxiety. But before we jump into the conversation, I'd like Dr. Zendi to introduce herself, tell us a little bit about your practice and where you're located, because we have people from all over the place. Some might even be in your area. So without further ado, Dr. Zendi.
Well, thank you, Nick. Firstly, I'd like to say thank you so much for the invitation to have this conversation about a topic I'm really passionate about. I'm Dr. Zendi Moldenhauer with a PhD in nursing, and I'm both a psychiatric as well as a pediatric nurse practitioner and board certified in functional medicine and functional psychiatry. I'm originally from South Africa, you might hear from the accent, and I am located in Rochester, New York, which is all the way upstate New York between Syracuse and Buffalo. And it can be super cold here in the winter, which might be surprising because I'm a sub-Saharan African girl. But this has been a really good place and my home for over 30 years. About 7 years ago, we started Arbor Health, functional medicine and functional psychiatry. And we see children, adolescents, and adults. And folks come to us either from an emotional perspective with struggling with anxiety or depression or ADHD, or from a physical concern. So maybe people come to us with overwhelming fatigue or joint pain or mast cell issues or lots of gut issues. And every time when we start with somebody, we're always trying to figure out the root cause for the underlying reason for which they're here. And then figuring out the root cause and addressing that results in remarkable improvements. We are unique in that we work as a team with health coaches as well as nurse practitioners over a membership program. And that helps people be so much more successful because so often medical providers can throw out some great recommendations. Patients want to be successful, they want to be cooperative, but they don't always know how, or they lose encouragement. And this way, our patients are really successful because the health coaches help hold their hands and help them be accountable and help them be successful. So we love what we do, and we love to share this.
Oh, wonderful. So diving in, you called this podcast Understanding Childhood Anxiety. Why did you decide, why not just understanding anxiety? Why did you pick childhood anxiety?
Well, for several reasons. I think so often childhood anxiety isn't well understood or discussed as often as it should be compared to adult anxiety. And I think parents specifically desperate to help their children and they don't always know how. I think I also offer a unique perspective in that I'm always looking at the underlying physical aspects of anxiety that I know we'll be discussing more in a little while. And I also think that the sooner you get at anxiety, as in the younger the person, the more effective it is at being able to overcome that anxiety so that it doesn't result in adult anxiety. Because left untreated, anxiety frequently persists into adulthood. So I'm always about trying to understand this and treat this as young as possible to prevent future anxiety in older teenagers or adults.
And also to help a person be the best version of themselves as soon as possible.
Right.
But I was also really struck how you noted to me that you like to reframe childhood anxiety as a whole body condition. And that's pretty unique in the sense of it's a more holistic approach. Why don't you tell us a little bit about what you mean by that?
Sure. Whenever somebody comes to me with anxiety, I'm always listening for the clues that got that person there in the first place. I think so often childhood anxiety is viewed as a behavioral concern, maybe a parent concern, maybe an inherent personality concern. And I'm always interested in what is going on in the body in terms of any underlying nutrient deficiency, of which we have so many nowadays, as in what the microbiome looks like and if there's any imbalances there, if there are any infections in the body and that's resulting in the presentation of anxiety. If there's any inflammation, I'm always interested in understanding that unique gut-brain connection because how we think drives how our bodies work and how our bodies work, especially in the gut, where over 90% of serotonin, over 50% of dopamine is made and then has to go up to the body. I'm always interested in what's going on physically that can be understood and tested and successfully addressed to resolve anxiety. And I think that's a unique perspective that's not always understood. Yes, therapy is still important. Yes, working with parents is still important, because the longer anxiety is in place, the more those neural pathways are set and laid down, the more behavior is starting, or habits are starting to be laid down, and the child is used to interacting with their world in a particular way. Parents or teachers are used to interacting with the child in that way. So that has to be unlearned. That has to be worked with in a therapist in terms of changing those patterns of behavior. But it's so much easier to do if you've addressed any physiological reasons for anxiety and got that sorted out.
Okay, but I want to dial this back a little bit. We're using the term anxiety a lot, but what does that mean for you?
Anxiety is a general sense of unease or worry or stress in the body. Now, a certain amount of that is completely normal. We live in the world, we're exposed to stresses, we have things that we have to face that are uncomfortable. We're always experiencing new experiences, people, tasks. And so a little bit of anxiety is pretty normal and helps us overcome obstacles, learn new behavior, expand our personality, our development. But when that worry or anxiety or stress becomes overwhelming and results in either physical symptoms like recurrent tummy aches, headaches, fatigue, or changes in adaptive behavior. So, for example, children not being able to attend school or separate from parents or leave their room, or behavior that's super clingy and obsessive, or children that start engaging in obsessive behavior, compulsive behavior, then we've stepped over the threshold from everyday normal anxiety that most of us experience to anxiety that is no longer functional. And so when we start seeing it either in physical symptoms or behavioral symptoms that prevent that child from being successful in their world, with their peers, with their teachers, with school, then it becomes an issue that needs to be addressed. The other thing is that there's certain periods of time in which it's completely normal to have a slightly higher heightened degree of anxiety. So young children, for example, between like 18 months to 2.5, maybe up to 3, experience some separation anxiety as their world is expanding and they're interacting more with the world. So that separation anxiety is a pretty normal developmental phase. We see that again around 5, 6 years of age, when children are starting kindergarten and there's a greater expectation, there's more separation. So we see that as a pretty normal developmental phase. We often see that in early adolescence, around 12, 13, that's around middle school, starting high school. And then often I see that in that transition to college or the workplace. And I think those are fairly normal developmental phases that need to be nearly predicted, not pathologized. Children often need just a greater amount of support and coaching and coping skills, either with a professional or via their parents, and if parents understand that and know that, then they're not as frightened by it, because then they're like, oh, this is predictable, this is normal, my kid needs some more coaching and they need some more support. And then the child is able to overcome that with a greater sense of autonomy and independence every time they are able to overcome those developmental phases.
So, but to bring it back a little bit, so for anxiety in young children or even teenagers, where you're in a situation where they're disinclined to talk about what emotionally is going on, the telltale signs of disengagement and physical discomfort that seems to be regular can be a telltale sign of anxiety.
I love that you brought that up, because exactly, children, especially the younger they are, but even teenagers, are not that great at saying, Mommy, I feel anxious, or I'm worried. Children don't necessarily have that self-awareness or the vocabulary to be able to do that. And so very often the telltale signs are the way that a child is behaving, how we see their behavior change. So for example, a child that might separate easily, seem like they're pretty confident in being beyond the parents' immediate presence who suddenly become super clingy or crying when they have to separate or fighting adults in their life when they're exposed to that situation or wanting to avoid or procrastinate. Those are all behavioral signs to indicate something might be going on. And I'd love to just remind folks then to not always interpret it as just bad behavior. I think all behavior is a symptom, is a language that just needs to be understood. So a child that's clingy or oppositional or avoidant or procrastinating might be feeling anxious because they lack that capacity in that moment at that time to be able to achieve the expectation, but they don't necessarily have the language or the self-awareness to say, oh, that makes me anxious. I'm worried about that. Please, can I have some help? Please, can you help me? So then we see that behavior. And if we can interpret that as, oh, my child might be struggling with anxiety, then a person's approach to that child is going to be very different, as in compassionate, supportive, compared to the interpretation of that as just bad behavior, where people might get rigid and forceful and have higher expectations, which obviously isn't going to help in that situation. The parent being able to clue in and say, are you feeling anxious? This is what anxiety feels like. When you worry, when you're thinking about that, it says that you're anxious, and let's talk about it and let's figure out a way to feel more confident in this situation.
Understood. But when we talk about the whole body condition, though, that implies beyond the psychological, are children and young adults more at risk for anxiety when they have poor lifestyles? They don't eat well. They don't sleep well. They don't address physical ailments. They just say nothing and deal with it. The parents let these things go. In other words, if we're looking at the whole body, it sounds to me like life's pretty tough, no doubt about it. But also there's a physicality to this.
Well, I like what you said there. There's a physicality to that, but there's also a lifestyle piece to that, as you mentioned. So if we touch briefly on lifestyle, that then impacts the body. Things like having a regular routine is super important. That's predictable, that's structured, that has a pace during the day in terms of meals or playtime or school time. That structure, I think, is important. Sleep is incredibly important, and so many of our children, and especially our teenagers, are not getting enough sleep and are chronically sleep deprived, and therefore so are their parents, which doesn't help as well. But I think children aren't always getting to bed early enough. They might be distracted or influenced by screens. There's so many more screens in the average house, whether that's a TV screen, a computer screen, a phone screen, a text screen. And I think texting behavior and the use of technology is definitely impacting our children, even from younger and younger ages. When we grew up, we probably had a phone connected to the wall. And now phones are being handed to children under 10 years of age who don't have the capacity to moderate that by themselves. So I think sleep is incredibly important, because if the brain is tired, it can't work well during the day. And I definitely see lack of good quality sleep as impacting the body psychologically, physically, academically. I think nutrition as a lifestyle factor is super important. I think that we so often are relying more and more on fast food, quick food, convenient food, less expensive food. Prices are going up, families are stressed, and so maybe choices are being made about the kinds of food being brought into the home that maybe aren't quite as nutritious as the body needs, or food is being brought on the run between play practice and sports practice and dance practice. That is because life has just become so busy that children aren't always getting the nutrients needed. And I say to parents, when the body makes neurotransmitters like serotonin, for example, the building blocks for that have to come from somewhere. Specifically, we need good quality proteins. Then we need all of the cofactors like the B vitamins and iron and vitamin C to be able to take those proteins within a healthy gut, because it's the probiotics growing on fiber in the large intestine that uses those proteins and the cofactors to actually make healthy neurotransmitters that then have to travel up to the brain to help with regulation. So if you don't have those building blocks, good vitamins, minerals, nutrients, proteins, how can the body make healthy neurotransmitters? And so we need those essential amino acids to help there. So I think that's a lifestyle factor, but directly influences the physical aspect, which takes us to the gut. The gut has to be healthy because if we're making over 90% of our serotonin, which is one of our major neurotransmitters to help with coping, then we need to have a good balance of healthy probiotics. So I always say we've got to have at least 85% good, healthy probiotics in order to keep the 15% less healthy at bay. So I think that is super helpful.
One of the things I want to just touch on briefly, and then I want to go back to the physicality dealing with inflammation, infection, is unstructured playtime. When I was a kid, that was allowing one to step outside of the structured, possibly stressful realm. And we used to say, blow off steam.
Yes.
How important is just unstructured, even creative playtime, kids?
Absolutely important. And I think our kids aren't getting enough of that. As you said, when we were growing up, we didn't have phones and screens, and we were playing outside. We were playing with toys. We were making up games. We were playing face to face with other kids, in which so much social behavior is learned. And so often now, our children are indoors, that they're not getting enough just unstructured physical activity, moving their bodies, swinging, biking,
Sunlight.
walking. They're not necessarily taking as many risks outside. It's helpful to climb trees or climb jungle gyms or ride bikes and deal with the stresses that come up with that. I think so often we're so protective that we don't want our kids to struggle, or we don't want our kids to get hurt, that there's a sense of overprotectiveness. We don't want our kids to get abducted in the backyard. We don't want our kids necessarily to walk down the street because we're worried about what might happen to them, compared to maybe more of the freedoms we had when we were little, maybe more of the unstructured time, maybe or more of the interactions with other kids that we had to figure out social communication without adult intervention. And we were not playing with other kids behind screens, because so often, definitely with teenagers, but playing is behind a screen playing Fortnite or other interactive games. And that's a completely different way of interacting and playing compared to face to face. So I think that's a pity. I think our kids should be playing outside more, unstructured play, more creative play, more playing in the dirt. There is some good research to show that we're nearly too sterile as a community, and that we need to be playing outside and in the dirt more frequently, because it's actually helpful for our immune system, helpful for our gut.
Absolutely. And we're going to come back to this because there's so much to cover, right, in this whole body condition. It's not just a simple case of you're facing stress. Let's talk about medical triggers a bit, right, in terms of anxiety, which to me sounds like a more severe case. In other words, there's something going on that's causing you to suffer.
Right.
Physically and mentally. And we all know, and I think one of the things I want to impart here, it's hard to do well. It's hard to deal with things when you're unhappy.
Absolutely.
It's a basic, and so when you're unwell, you tend to be unhappy, and then it seems like life's just piling more and more on you. So let's talk about medical triggers in particular, and then I want to bring this back to summarize what we've gone over, because there's a lot of good stuff here.
Okay. So I would say some of the major physical medical triggers that I always pay attention to and I'm always looking for. One is the nutrient deficiencies, the gut imbalances, blood sugar instability, inflammation, and a nervous system that is stuck in fight or flight. But I want to highlight one aspect, because I think so many of our parents don't understand or know about this. And I'm definitely on a mission to share the role of infection with parents. So there's a condition called PANDAS or PANS that I'd love to speak about a little bit more.
Please do.
So PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Strep. And that's one type of condition under the broader umbrella, if you will, of PANS. So PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. So what that means is, in a healthy immune system, children might be exposed to a variety of infections. It could be strep, could be mycoplasma or walking pneumonia, it could be different ear infections, it could be Lyme disease, and the body, in its defense, would create antibodies to help fight that infection. And in a healthy immune system where everything is working normally, once the body has fought that infection, it goes quiet again and the child is well again. So they might have had earaches or a sore throat or fatigue or headaches. They've had that illness and now they resume wellness. Well, in a certain group of children, and technically it's 1 in 200, but in my experience, it's way more than 1 in 200. And I see this more and more frequently over the last 10 years. The immune system gets confused, and those antibodies that have been created against that infection, let's say strep, cross over the blood-brain barrier and attack the basal ganglia of the brain. That results in a variety of symptoms that primarily look like acute anxiety in a great form, like severe anxiety that seems to come out of nowhere. So this comes on within days to weeks and as a complete change to the child's baseline. So it might look like acute anxiety or separation anxiety or OCD or extremely picky eating or food aversions, which nearly looks like an eating disorder, but eating disorders don't come out of the blue. Eating disorders don't happen within a few days to weeks. So that's always a symptom, a clue. The other kinds of symptoms that one might see is a change in behavior, so maybe more clingy, maybe more oppositional, a change in academic performance. So somebody that might have learned how to read or do the math facts suddenly can't, a change in handwriting, a change in balance and knowing where they are in space, starting to have urinary accidents either during the day or at night, having lots of physical concerns like headaches or tummy aches, a heightened sense of sensory sensitivities, the light's too bright, the noise is too loud, kids are overwhelmed. And you don't have to have all of these symptoms. You need to have either the picky change in eating and an acute anxiety, OCD, and then just 2 of the symptoms that I mentioned. So when that happens, it's a sense of the brain is inflamed because the immune system has turned on the body. That's the autoimmune word within the definition. So pediatric acute onset neuropsychiatric syndrome is what looks like anxiety that comes on quickly, but it's as a result of neuroinflammation in the brain in an autoimmune aspect. And so treating that with an anxiety medication like an SSRI isn't going to make any difference at all. What has to happen is you have to try and figure out the source of what is going on, like strep or Lyme disease or mycoplasma, and actually treat the infection. So that presentation of anxiety is often treated with an antibiotic and has dramatic improvements in anxiety. It's treated with anti-inflammatories, starting with regular old Advil, and treated from an autoimmune aspect. So there's often immune modulators that we use. So if we can identify that, the quicker you can identify that, the quicker you can appropriately treat that with antibiotics, anti-inflammatories, immune supports, the quicker that disorder can be overcome and the anxiety resolves. I've seen kids completely get better from PANS, but the quicker you intervene, the easier it is to treat, the more successful the treatment.
Okay. So I want to bring this back a little bit. I want to put the medical triggers on the side because we've covered a lot. It's very interesting. So for a typical child that starts to exhibit behaviors beyond coping difficulties, we need to start to look at their habits, their sleep habits, their eating habits, their behavioral habits, all of which we need to support, right? The failure to support these habits can make them more likely to lead to anxiety. In other words, it's all interrelated. It's all important to maintain these foundations in good diet, good sleep, good health to address potentially physical triggers in order to avoid, is what I heard you say in the beginning. That's something different from medical triggers in and of itself. Do I have that right?
Correct.
Okay. And obviously, medical triggers, it sounds to me, reveal themselves in very significant ways. For parents that feel like something isn't right here, they're not eating, they're not sleeping, their behavior is way off, they're getting sick a lot, they can't focus at school at all, deserves medical attention. But I think where I want to go back is to where we were before. The child that seems to be anxious, it's not a severe medical trigger. Their sleep and their eating is affected. What are some of the effective regimens to deal with this stuff? Which sounds more like, I don't want to say everyday anxiety, but it sounds more like more manageable anxiety, obviously with the help of a professional like yourself. What do you recommend?
I start with food. I think that speaking with families about making sure that we're getting good protein sources, that we are getting good sources of fruits and vegetables to get all of the essential vitamins and minerals, that we're removing the junk because our kids are eating a lot of junk. So we're removing fast foods, cheap fats, like olive oil and coconut oil are fantastic, but the fats that are in fast foods are not. That we're removing colors and dyes, that we're removing lots of sugar and lots of processed food. So it's the removing of the stuff that's just not helpful for the body, and it's putting in the building blocks and the healthy nutrition that is helpful for the body. I often will recommend a really good multivitamin. Like I love the active needs or the spectrum needs because it fills in some of the nutritional gaps that are missing from an average diet. Unfortunately, the nutrient quality of our food nowadays isn't as good as it was 10 and 20 years ago due to mass agricultural production. So I think starting with diet is super important. Then the next thing that I like to make sure of is if we're not getting enough of the healthy amino acid building blocks, then one of the things that I feel is really safe with children, and I use it all the time, is L-theanine. So L-theanine is the amino acid component of green tea. Now, you'd have to get 20 cups of green tea for one capsule of 200 or 10 cups of green tea for a gummy of 100 milligrams, and nobody's doing that. I'm not asking any of my patients to do that. But L-theanine as a supplement can be super helpful. I love the Calm Needs because it's got L-theanine and it's got GABA and it's got glycine and it's got some B vitamins. And again, that's just such a clever combination to help with generalized anxiety. So that's often where I start, is some good quality nutrition, preferably from diet, but then sometimes using some supplements can be very helpful. A good quality omega-3 can be really helpful. Making sure folks are getting those B vitamins, especially in the methylated form, are really helpful. So that's always where I like to start, is nutrition and some basic supplements.
And what about, we talked about this a little bit, lifestyle routines in terms of sleep and playtime and quality family time. I think the family unit as a support system, both emotionally and physically, can be very powerful.
Absolutely. I love collaborating with families because remember, children exist within their families. If they come and see a mental health professional, it's once a week, once a month. So the more we can do to support families, to help their children, they're their primary therapists, if you will. So, but families, I think, often are overwhelmed, tired, not sure what to do. They want to do the right thing, but there's so many influences, whether it's AI or social media or friends and family. So partnering with families, I think, is important, and helping them, really reminding them of the basics, like helping them with structure, reminding them about good sleep, and brainstorming some sleep strategies, and maybe using a little bit of L-theanine or some melatonin or some magnesium to help with sleep, reminding that kids need active playtime and outdoor time, reminding families to limit screens, and really like giving permission, like, yes, it is healthy to limit screens, because I think families are influenced so much by social pressure as well. So definitely getting back to those basics, working on healthy communication between parents and kids, and helping parents with the language to be able to help the child depending on their developmental age. Because obviously the way you speak to a 2-year-old is different from an 8 or a 14-year-old, but helping families with that language to help their kids identify, talk about, express. And then if that has those things have all been in place and still struggling, then the help of a mental health professional, I think, can be so helpful, whether that's a psychiatric nurse practitioner or a social worker or a psychologist or a school counselor. I also work a lot with collaboration with the schools. Kids spend so much time in schools, and that's where they can be having a lot of difficulty. So I think frequently interacting with the school counselor, the school nurse, the primary teacher is helpful. Many kids actually need a little actual support in a more formal way, like maybe a 504 plan, where there's specific strategies and supports written into the school plan so that no matter which teacher they're with, there's a consistency for support. So that is often a key feature to help kids, especially with the more severe anxiety, definitely with PANS, PANDAS.
Well, Cindy, unless there's anything else you'd like to add, I think we're going to stop here, but I'd love to have you back to talk in greater detail about the medical triggers. I think that's something that a lot of parents, including myself, don't understand in terms of the connection between medical triggers and severe anxiety.
Thank you. I'd love to do so. As I said, I'm really passionate about helping parents know about and understand more about PANS and PANDAS, no matter what the trigger, including Lyme disease. So that would be an interesting conversation as well.
All right. Well, thank you very much. And we hope to see you again soon, but I'm sorry.
You're welcome. We've written a really lovely guide for your listeners. It's called What's Really Driving Your Child's Anxiety, a functional medicine guide for parents who are ready for real answers. And it summarizes much of what we've talked about today in a real meat and potatoes way. It's a really helpful guide. And we have a link if any of your listeners would like to access that guide.
Most definitely. We'll make it available. We'll make it available
Okay.
to our listeners.
Okay.
That's really wonderful. And we'll definitely have you back. It's been a real pleasure.
And the link, if anybody wants to access that, is arbor-health.com/neuroneeds.
Okay. Well, thank you very much, Cindy.
Thank you so much, Nick. I really appreciated this conversation.
Take care.
Bye-bye.
As always, consult your physician before trying any of our products. For more information, visit neuroneeds.com. We would appreciate it if you would like, share, and subscribe. Thanks for being part of our journey.